Boo-boo.
Yeah.
It's National Children's Dental Health Month.
See, okay, pediatrician Dr. Jamie, thank God Dr. Friedman is here joining us this morning with more. Doctor, good morning.
Good morning.
Okay, let's talk about when should parents start brushing their kids' teeth? Because we know that dental hygiene is so important starting at a very, very young age. Explain that if you could.
Yes, dental hygiene is very important, even with baby teeth. A lot of parents think that the kids are going to lose their teeth so they don't have to take care of them, but that's not really true. It's really important that kids have good dental hygiene, because if they have cavities and rotten teeth, it's hard to eat, it's hard to talk. So as soon as the teeth come in, I recommend they brush them off, a little baby brush or a little washcloth. Very easy to just get in there and clean them off.
This is a thing in my family. We brush the teeth. The kids, I take them to the dentist every 6 months for their checkup so they're not scared of the dentist. And the dentist explained it very well to them that the little food buggies get in between their teeth.
Right.
So it's important to floss.
Sugar bugs.
Sugar bugs.
Sugar bugs.
Exactly.
So when you say that the kids need to start young, it's like the first little tooth that comes out, get going with it.
Yeah, I recommend they start brushing right away. They can even start using a very little dot of fluoride containing toothpaste, because the fluoride will coat the teeth and protect the teeth.
Okay.
At what age is it when you're a baby, do they go to the dentist, or is it 2?
It's a tooth, right? When they get their tooth?
You know, if you're seeing a pediatric dentist, they'll really see them at any time they start getting teeth.
Okay.
When I'm in an exam doing checkups, I usually recommend by age 2, this is the limit. Some dentists who don't see a lot of babies may not make that recommendation, and sometimes kids going in 3, 4, 5 already have cavities, so you don't want to wait that long.
Wow.
No.
Yeah. Yeah.
And
My kid had a cavity at like 2. Poor thing had to, one of those.
That thing.
Daddy teared up. And
But the
boy was
smart
fine.
thing is when you get them in, because the dentist, adults, with all due respect, don't like going to the dentist all the time, but when you take a kid there and they get familiar and they get it, it's not as scary of a place.
Yeah, and the kid dentist is so much more fun than our dentist. There's like videos on the ceiling, and video games in the waiting room. I mean, when my kids go to the dentist, I'm not even sure they realize what's happening, because there's so much else going on.
Phase 1 braces. Explain this to me, because our kid just got this, and now at 7 or 8 years old, the kids are getting these phase 1, and then maybe when they're older, they get phase 2. Can you kind of give me a rundown of what that means?
Yeah, my kids have gone through that too. They're just kind of alternating. If someone has braces, someone doesn't. And what's happening is, you'll see with your kids that when they start getting...
That's my kid, by the way. The day
really
she got
cute.
her, we gave her a
Look
little...
how happy she is.
I know, she loves it.
But what you'll see when those permanent teeth start coming in, they're huge, and the little kids' teeth their mouths are small, and there's not a lot of space. And then you run into, what's going to happen when all of the teeth come in and there's no space. So when they're starting young, a lot of times they're starting with expanders. Did she do the expander with the little?
She did the expander,
the
and
turnkey.
Then, yeah.
So they'll do a lot of that to start to make some space for the adult teeth. They might do a few little braces on the front, the newest permanent teeth.
Right.
And then they kind of give them a break. And then when more of the permanent teeth come in when they're teenagers, then they do another set where they're doing them on all of the teeth.
Why is this a trend now, not 10, 20 years ago?
I don't know, like anything in medicine, more data and more experience kind of shows you what is going to work better or have the least impact.
So the kids...
But getting braces now at this age doesn't guarantee that when they're 12 and 13 they won't have to get them again.
They usually will have to get them again.
Really?
Yeah.
Oh my.
Why?
Because they're getting more of their permanent teeth.
Oh, if you do the phase 1, phase 2.
Yeah, if you do the 2 phases.
I was going to mention, I'm happy I don't have a picture of this, but my teeth are real. Some think that they're like veneers. I have braces for 5 years. The big metal ones with the headgear that came out and went around.
Right.
With the color rubber bands.
A lot of that stuff depends on your jaw too. I mean, if you have an overbite and underbite issues with your jaw, the orthodontist is going to do a lot of different things. But what I'm finding is that the 2 stages, each stage is kind of shorter than just doing all of them. Like when we were young and everyone had it in middle school, high school. Now there tends to be a little bit shorter.
Yeah, because this phase 1 was like 10 months, and then 10, 11 months or something like that.
Yeah, and then you take them off, and then you wait a little bit and get them back.
Okay. Put my picture.
It's like
where's my daughter's picture up here? Look at my baby.
It's cooler. It's
She's
cooler.
8 years old. Look at her.
Like...
She got like black and then pink.
Yeah, they can change
to make
the bands.
it cool.
It's super fun.
She's a cool chick. Okay, Dr. Friedman, thank you so much.
Thank you for having me.
So it's okay to have the phase 1.
Yeah, you're fine.
I was falling apart. Why was I falling apart? What's wrong with me? All right, doctor.